Good morning, everyone. Today is Thursday, July 6, 2023. I'm Dr. Yamonja Smalls, Director of Professional Development for Maryland Department of Health's Developmental Disabilities Administration. We welcome you today to today's presentation of CCS Provider and Training Matrix. On the panel today, we have Nicolette Papardamas, Statewide Director of Coordination of Community Services, Leslie Thompson, Statewide Director of Provider Services, Nick Burton, Director of Programs, and Jennifer Metrick, Executive Director of Liberty Healthcare Corporation. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options to hear the webinar, by computer and phone. If you look at the panel interface to your right labeled audio, you can click either computer or phone to switch for your best option. We will be recording the webinar and posting this session on YouTube and the DDA website. Today's PowerPoint has also been uploaded as an attachment and is available for you to download in the webinar panel box. If you're listening by phone, you can also request that it be emailed to you. Questions can be typed into the question or chat box in the webinar panel, and we will get to those towards the end of the presentation. And now I'd like to introduce Nicolette. Good morning, Nicolette.
Good morning, everyone. Thank you so much for that warm introduction. I hope everyone is doing well, excuse me, and have some water today. It seems like we both, but it is a warm day. I hope you're staying cool, and excited for you all to join us for today's presentation. If we could go to the next slide, we're going to be going over the training matrix and why it's important. What is this but a roadmap to help support your agency's training requirements? We're going to point out the differences between the CCSs and the providers and how it's specific to their roles. We're going to review the CMS competencies and the services as we integrate charting the life course in everything we do. And we're also going to think about some of the considerations, right? So what, now what? What are we going to hold on file? Do we need certificates? Do we need transcripts? What should we all keep? So we're going to go into that a little bit further. And then, of course, at the end, we're open to all of your questions. And in case we don't want you to forget anything, we have the questions box that you can enter all of your questions throughout the training. Next slide, please.
Good morning, everyone. So glad you could all join us today. This is Leslie Thompson, Statewide Director of Provider Services with DDA. So what is the training matrix, right? What is this thing? So ultimately, this was a tool that we've created for both CCSs and providers to help make training easier. We had, heard a lot of feedback over the last several months and decided, we need to get something out there to hopefully, just make things a little more straightforward and easier for everyone. So essentially, the training matrix for both CCS and provider, it outlines the training requirements for both groups. It also provides resource options for training, and Nicolette will get into that a little bit more in a little bit. Additionally, and I think this is really useful, it links all of the training requirements to their authority. So whether it be COMAR and or the waiver policy, it takes you directly to what requires that training or what authority. And then lastly, and something else we'll also get a little bit more into later on, it suggests additional training. So in addition to the trainings that are required by COMAR waiver policy, we wanted to, offer some additional options too and things that we think are important. So next slide, please. So really, why is this training matrix important? So really, we want this to be, like I said, a tool that makes things easier for you. One, easily accessible. So it's going to be kept up to date as new trainings become available. As an example, if we put out a new training as DDA, we'll make sure that we get it linked into the document in real time once the recording is available. So something that's going to be kept up to date, easily accessible. And then as part of that, we wanted it to ensure that retraining requirements are clear. There are a lot of requirements, and we know that, and it can be quite a lift to find all of those different things if you're looking in various sources, various places. So having them all in one spot and making sure it's clear. And then, we want this to be able to support CCS and provider agencies with helping you keep your staff's training current. So with that, next slide, please. I will pass it back over to Nicolette.
Thanks, Leslie. So as we look at the training matrix, you'll see in yellow subjects, right, for each row. What do they mean? A curriculum is the subject of the training. The audience would include the staff who should complete the training, and be mindful that we do note that all are required unless we note otherwise, and you'll see a little asterisk with that. We also include the general knowledge. What are the core areas the training should cover? The time frame from date of hire. When does the training need to be completed by? The authority, right? So what source requires the training? And again, the resource link. So it includes the suggested training resources, and just, those that are included without links are DDA's training deliverables. So we will dive into these more shortly, but first we're going to go into the next slide where we will discuss some of the highlights in the CCS training matrix. Those include general knowledge tiers and the presence of separate yet interconnected trainings. So only 2 of the trainings under the curriculum are broken down into 2 parts: LTSS enrollment and the use of the HRST. LTSS enrollment and use are divided based on the audience and the respective training needs. So for example, part 1 is required for CCS providers who have recently been approved and certified as case management agency. In this training, they're going to learn how to apply for and obtain their Medicaid service billing number, understand the functioning of LTSS non-EVV billing, and familiarize themselves with other admin functions. Part 2 is recommended for CCSs, CCS supervisors, and their quality assurance specialists. The training focuses on utilizing LTSS to its fullest potential, including understanding the types of alerts users can receive and their meanings, as well as utilizing the reports provided by LTSS. Another example, right, so we said there are only 2 that are divided in 2 parts, is the HRST. This training is divided in the online rater training, which serves as the foundation of HRST, and the advanced rater training, which we call ART, that was launched September 1st of 2022, and it's aimed at enhancing the rater's existing knowledge. Excuse me. Another key highlight of the CCS matrix is that many of these trainings are listed separately, but we must remain mindful that they're interconnected and are essential for filling the CCS roles effectively. For example, the HRST, self-direction, and DDA waiver services trainings are listed separately, but they hold profound significance in person-centered planning development. The HRST serves as a vital tool for assessing risks, ensuring the well-being and safety of people. Self-direction empowers people to hire their own employees and vendors and manage their own PCP budget. And equally important are the DDA waiver services, as they may offer people supports that match their specific needs and goals. These trainings, along with various others, collectively equipped CCS professionals with the knowledge to help people understand their choices and needs in the development of their person-centered plan. The interconnectedness of these trainings can be linked to the gears of a well-oiled machine. Each training represents a different gear that plays a vital role in the overall functioning of the machine. Just as the gears work harmoniously to ensure smooth operation, these trainings work in tandem to equip CCSs with the necessary skills and knowledge for person-centered planning. Each training acts as a cog in the system, enabling them to effectively support individuals, align their choices and needs, and facilitate the development of a comprehensive and meaningful person-centered plan. And now Leslie is going to go over the highlights of the provider matrix.
Next slide, please. Thank you. So you'll probably you've noticed that the CCS and the provider matrix are very similar in how they look, but I wanted to go through the columns for the provider training matrix just because there are a couple additional columns. So much like the CCS column, we have the curriculum column on the provider training matrix. One of the additional columns we have on the provider training matrix relates to services. So, you know, there may be services, for example, you know, housing support services or employment services. There are services that are required specifically for those services that may not be, or that aren't required for, say, you know, someone working in community living. So it defines what services or service that particular training or curriculum applies to. Next, we have audience, much like the CCS training matrix. Additionally, the general knowledge. So those are the items that, you know, we want folks to walk away from their training with. Again, time frame from date of hire. Authority, so where does it link back to? COMAR, the waiver, the Medicaid, the Maryland Medicaid Provider Agreement, whatever those authorities may be. One additional column that's different from the CCS provider matrix is the CMS DSP competencies. And I'm going to talk a little bit more about that on the next slide, so just bear with me 1 second. And then, of course, we have the resource links column on the provider training matrix document as well. So next slide, please. Let's talk about some more specifics. So we talked about the service column and how, you know, not all training requirements or suggestions apply to all DDA waiver services. So that's why we thought it was important to add in that service column to make it clear what service it's for, whether it be for all, whether it be for 1 or 2, it's noted in that column. The CMS DSP competency column. So you may have read in our newsletter, the DDA Connection, a few weeks back, that this matrix is really kind of the first in a multi-phase rollout that we're planning, working with the training consortium, where we really want to make sure that we have aligned our trainings in the state of Maryland with the competency-based trainings or competency sets that were created and validated nationally by the Center for Medicaid and Medicare Services. So it's really a core competency set that we wanted to link all of these trainings back to. Next slide, please. So a little bit more on that. So all DSPs all over the country, really, but obviously we're just talking about Maryland. All DSPs should have a common nationally validated level of core competencies that are a part of their training. And, you know, the nice thing is, you know, because I probably some of you are thinking, oh my gosh, this is just another thing that we're adding onto the list of things that we already do. And those lists are long. But the good news is you're already doing this. You know, you're making sure your staff get these required trainings. We just want to show that connection and really reinforce the value of what is already required with that kind of bigger macro picture and understanding of what our DSPs do. So that's really the connection there from the required trainings to that DSP core competency column. And the nice thing is, you know, kind of the virtue of having this nationally validated set of competencies is that there are a lot of training options to get there. You know, a lot of you know, whether you create your own trainings, whether you go through, you know, various other sources to obtain training for your staff, we're all going to get to the same place as long as we're drawing that connection and reinforcing that value. So really, you know, wanted to point out too, you know, where can you find the competencies? Because I'm sure some of you are wondering that. We do have the link to the CMS website on our very last slide in this PowerPoint presentation, so you'll have access to that. So you can have those as a reference. But you know, when your staff are taking these trainings, you are aligning with the CMS competencies. Again, this is nothing new. This is not a new requirement. We just want folks to start making that connection. And again, you know, I can't say it enough, you know, reinforcing the value of what is already, you know, required with that higher level understanding of what DSPs do, all while still having that freedom of method of how your staff receive the trainings or how you do the trainings, just all getting to the same place. Ultimately, you know, like I said, we worked with the Maryland Training Consortium on this and will continue to do so. It's been a great collaboration as we work through this and look forward to continued iterations of the document. Next slide, please.
All right, so what do we do with all of this now? So now what? The resource links we provided you give you options and suggestions as you determine how to train your staff, whether you create your own training programs or use third-party platforms like Relias or Direct Courses, some of you already do. These links have a lot of useful information to cover the important general knowledge aspects required for your role. So if you decide to create your own trainings, you don't need to have those reviewed and approved by DDA. I'll say that again. If you decide to create your own trainings, you don't need to have those reviewed and approved by DDA. As the DDA begins to offer more charting the life course learning opportunities, you can incorporate those principles of charting the life course to design trainings that focus on person-centered approaches, self-determination, and individual needs. Sometimes certain trainings like the HRST might be the main training you receive as they're offered within the specific system. PORI is another training that will be provided by the DDA, and after the recording is provided at the end of the month, it will be linked to your training matrix for easy access. So while these trainings might be the only instruction on certain topics, they're designed to give your staff the knowledge and skills they need to do their jobs well. Another thing to point out is the difference between the required and the suggested trainings. Required is what's detailed in COMAR and the waiver. Suggested are training topics that apply to areas that would be beneficial for your staff's roles, but are not currently required by any authority. All of these suggested trainings tie back to the important work you're all doing to empower people and promote their journey towards a fulfilling life. Next slide.
Okay, so how are these training requirements being monitored? When we sought feedback from various stakeholder groups in the CCS and provider universes, this was iterations of this question came up a few times, so we thought it would be important to address it in this webinar. So documentation that CCS and provider staff are meeting the DDA training requirements. There are a couple different routes that they're being reviewed. So they're being reviewed through your licensing and certification process, through OHCQ, you know, when you submit your renewal, or when you submit your renewal documents, and as a new provider as well when you apply. So nothing changes there. That's still the same process it's always been. And then additionally, and this is something that has been, you know, being socialized over the last year, we were reminded recently that the QIO has been in place for a year now. Been a busy year for them, and they've been doing great work. And part of that is the utilization and qualified provider reviews that are being conducted by Liberty, our QIO, on behalf of DDA. And those reviews are really kind of what spurred us into action, if you will, in regards to this training matrix, because there was a lot of feedback given during those kind of pilot reviews to the QIO that, you know, the training stuff was a little confusing and, you know, maybe not always clear. So that's when we all kind of joined forces, collaborated, and made sure to get a useful tool put together and out there for you all to use. There will be some guidance coming as it relates specifically to the utilization and qualified provider reviews. We're just finishing that up, and so more information to come on that. But just kind of wanted to give you an idea of how training requirements are really being monitored. Next slide, please. So really, what should you as providers be doing to maintain that documentation of your staff's training? So you want to maintain documentation that has the date of hire of your staff, the initial date of the training, the title of the training, any training renewal dates when applicable. Obviously, some require, you know, MANT, for example, requires a renewal, but not all trainings do. And then evidence that training was completed. You know, Nicolette mentioned this a little bit ago. You know, whether you utilize a system that has you print out certificates for each individual training, keeping those in your staff's file, or, you know, any kind of online training record of completion, training sign-in sheets with dates and times of the training, or even, you know, if you utilize kind of a transcript method where it has, you know, that kind of staff demographic information at the top, and then lists all the trainings that they've gone through. So, you know, everybody does it a little bit differently, and that's fine. These are just those key points that you want to make sure are captured in whatever method of documentation you choose to use at your agency. So with that, I think we can open it up for questions.
All right, so on the audience, those listed under that category are required to take the training. The all are required does not refer to the entire organization, just those positions listed, correct? Yes, so under that column, it is per that, so you're looking at the rows, right? So that column just defines who it is applicable to take that training, and you would connect it with that curriculum on that row, if that makes sense. So correct, it doesn't refer to the entire organization, just the position listed according to the curriculum. You got it. All right, next question. This one is for you, Leslie. My question is, since we do MANT, and I apologize if I said that incorrectly, are we still required to do BPS part of the DDA core as it is still listed in DDA site?
Thank you, Nicolette. That's a good question. So there was quite a bit of discussion around MANT and the kind of the subtopics, if you will, or curricula that is captured in MANT. So if you look at the MANT general knowledge, as well as the curriculum cell as well in the matrix, it will tell you exactly what is needed for which staff You know, because obviously it's a little bit different if you're a staff working with someone who has a behavior plan versus not, you know, that more kind of advanced training, if you will. And hopefully I'm not butchering the lingo here. It's been a couple of years since I went through MANT. But it will tell you exactly what is needed, and you should be covered there as long as you're following what's in that general knowledge. And a side note too, we probably should have said this earlier, but we did have all of our sort of subject matter experts weigh in on the their kind of areas. So, you know, Dr. Meg De Pasquale, she helped us with the MANT columns, or excuse me, the MANT row. Nursing, Adrienne Holloman, we wanted to make sure that we had everybody's eyes on it to make sure we were capturing everything correctly. So shout out to all of those folks as well. It was truly a team effort. And also we'll make sure, we'll make sure as well that we're looking at the website and making sure things are updated so you're not seeing conflicting information.
Since we're on the topic of MANT, there is another question related to it. It is, since we do MANT, are we required, oh wait, that's not it. I'm sorry. Are there any plans or methods to reimburse providers for the cost of MANT training?
That is not a question I can answer at this moment, nor I don't think Nicolette can either, since that's, you know, I think there are discussions happening, but, you know, no concrete answers as of yet. But I'm sure once there are, that will be communicated out to folks promptly.
Okay. Are agencies limited only to the sources on resource links? No, you're not only limited to those resource links. There's suggestions that we found would be really helpful. But again, there might be some trainings like the HRC or PORI, right, or LTSS that might be so specific that those resources would need to be utilized. Is training documentation, for training documentation, is an Excel file matrix acceptable, which starts as backup? So is an Excel file matrix acceptable with certifications as backup?
As long as you are capturing that those key pieces of information that we noted on our previous slide, you know, if you have documentation in whichever format, it is great. It's just it's the information that's key. So if an Excel document works better for you, that's fine. Transcripts, like we said, certificates, whatever that looks like for you as an agency. And Nicolette, I'm just going to address this comment here too, kind of to go back to the MANT question. It sounds like e-tracking, is that e-tracking and e-training solutions, I believe is what it's called. They are reporting BPS as part of the DDA core, and so we'll make sure that, you know, our website's updated and that all the necessary parties that need to be informed are informed of any updates, revisions, whatever those might look like. So thank you for that. Moving on, I'll just tackle the next one too. Are DSPs required to have training on PORI? That is a great question, and that was actually a piece of feedback that we received from stakeholders. So you'll see on the provider training matrix, there's essentially two rows for incident reporting. One is specifically to PORI, and that is geared towards the folks within your agencies who are the ones entering the incident reports into the system. So, you know, whether that be, you know, your QA director, QA manager, case managers, whoever that is internally, those are the folks that PORI specific training is geared towards. However, your DSPs do need to know what your internal process is, right? So whether you use, you know, eye care manager, TheraP, whatever that might be, or whatever other processes, you want to train your DSPs on what incidents are, right? What that could look like and what their responsibilities are within your organizational structure and how to report them. So you'll see that on the training provider training matrix, excuse me, in the row right under the PORI training. Seeing if there are any that are kind of in that same. Let's see here. There was a comment about providing resources for folks that you support related to sexual abuse awareness and prevention training. We can certainly, you know, look into that and offer some resources for you. But please note, this training matrix is specifically for staff. So we did not include any trainings, while some of them may be perfectly relevant and applicable to folks you support as well. It's geared towards the staff at CCS and provider agencies. But we can certainly look at what resources we have related to trainings for folks you support as well. I see there's also a question about approaching the approval for being a Medicaid provider. That is a big question with a lot of steps. So I'm going to suggest that you, at the end of, on the last slide of this PowerPoint is my email address, Leslie Thompson. Feel free to reach out to me directly and I can point you in the right direction. Nicolette, it looks like there is one for you. Oh, you already marked it for yourself. So Nicolette, will CCSs receive any training on MyLTSS in their role in helping people set that up if needed?
Absolutely. Yeah, thank you for bringing that up. We are working internally already on developing that training and guidance. We will also establish a pilot group. We just want to make sure that the information we're providing in the training will be helpful for not just CCSs, but for the people we're supporting who will be using MyLTSS. So yes, in the next month or so, you'll be hearing more from us.
And you've got another one. Can you speak a little bit to CCSs and MANCH training? The question specifically is, where can we get the MANCH training for CCS?
Well, my understanding is that, well, Leslie, you might be better at answering that. I don't believe the MANT training is provided to CCSs, but I could look into that further.
Right, it's not required for CCSs. You know, certainly if it's something that you wanted to look into, that's something we could probably assist you with, but it is not something that is required for CCSs. What is the effective date for these requirements? So like we mentioned earlier, these are all things you're already doing, right? So there's technically no effective date, if you will, because this isn't anything new. This is just a tool to help you kind of organize your thoughts and your resources and things related to training. So please use it as you see fit. And I believe there had been a question in the list somewhere about where it can be accessed. We do have it linked at on the last slide of the presentation. But know that you can also find it on both the CCS Maryland DDA website page and the provider page. We put them in their respective places. And one other thing I wanted to note, back to the CCS MANT question, if you're a CCS agency that wants to look into MANT, you could certainly connect with Dr. Meg Pasquale, our Director of Clinical Services, or we could connect you with her to help you with that. I think there was one more. Okay.
There is one. Will DDA be offering the Train the Trainer classes for DDA classes in the near future? That is being looked into, so more to come. Other than that, I think that's it, unless anybody has any other questions. Okay.
I was looking through the list and I found another one. If administrative employees might provide direct supports in an extenuating circumstance, will they be expected to have DSP required trainings? Obviously, in these unprecedented times, that's happening quite a bit, I would imagine. Administrative staff working either in your day programs or in the homes with folks. It's really best practice if you are working directly with a person, especially if, you know, just you, that you have those really basic health and safety trainings. So, you know, CPR, first aid, obviously if you're going to have to administer meds, CMT. So, you know, you want to make sure that you're, essentially, if you're alone, you need to be trained. And obviously it's hard to plan for extenuating circumstances. But I would suggest, you know, if you are in a situation where you're an administrative staff and you are working, you know, alongside other DSPs that are employed by your agency, you know, maybe that's something you work out amongst leadership to kind of determine what the best route would be. I found one more here. On the topic of seizures, I see it's listed under general characteristics and it's also its own row. Is the intention that a general overview of seizures is reviewed for all staff, but the person-specific training is also required? So yes, with a definite focus on the person-specific training. We all are aware that, you know, any person who has a seizure, whether they have a disability or not, those seizures can look very, very different, and they do look very, very different from one person to the next. So that person-specific training is very, very important. But it also should be noted that, you know, there are some typical general characteristics that it's important to hit on for all staff, but certainly with a really heavy focus on that, you know, person-specific piece, as noted in the PCP and the nursing care plan. We got a comment that with Appendix K training stuff might have been a little confusing, but it should be more concrete now. So that's good to hear. And I would agree. Some of those extenuating circumstances can make things a little extra confusing. All right. Well, I think we hit every question. Oh, here's another one. Y'all are keeping us on our toes. Is CMT required if the participant is not taking medication? If you are a staff that is working with someone that does not take medications, or you're a staff that is not in a position in your agency where you have to give meds, CMT is not required.
And I think it's really important to note that, you know, what's on the provider matrix is specific to the provider agencies, and the CCS is specific to the CCS agencies. So what's on the provider agencies doesn't mean that the CCSs have to take that. Only noticing because it might be CCSs asking some of these questions, and I don't want there to be confusion that you have to use both matrices.
That's a good point, Nicolette. Yep. And to add to what Nicolette just said, again, there are similarities between the two, and there are some trainings that are on both, but there are quite a few differences. So yes, if you're a CCS provider, you're looking at that CCS provider training or big CCS training matrix. If you're with a provider, a traditional provider agency, you're paying attention to that provider training matrix.
Do you have to train on PCP annually, and what is the time frame? Well, we suggest, you know, it is required upon hire, right? But we do suggest that it would be good practice to train annually, but it isn't a requirement. So that would be up to you and your leadership teams to determine what that would look like.
Thanks, Nicolette. And another one for you. We have someone who said they read in the CCS monitoring guidelines something about CCS verifying provider staff training. How does that work?
So I would say for the CCS monitoring one, we are going to offer a training on that in the next upcoming month or so. But two, it's not that you're verifying staff training, it's that you're utilizing it as a confirmation. I believe it might also be in the CSQ guidelines, right? But it would be more on the lines of, hey, checking in, asking, talking with the provider and their teams and saying, is it, you know, can we look at this, take a look at it? But it isn't that you're verifying things, it's that you're working together to ensure that the person is receiving the services as indicated in their person-centered plan. Remember, we're working as a team. But the training on the individual's PCP is required annually, correct? Elaine, you bring up another question now. Leslie, that might be for you. It's being trained on the PCP annually. Well, actually, I could answer that, sorry. When the PCP is changing, then absolutely staff should be trained on what that person needs. If there's anything you want to add to that, Leslie, please chime in. That's fine.
Yeah, I mean, you know, the plans are updated annually. So with those updates or revisions, you know, it would make sense that staff that work with that person would need to have, you know, training to make sure they're up to speed on what those changes were or are.
Exactly. A follow-up to the CCS documentation on staff training. Are they supposed to provide CCS documentation of staff training? I think it's not a matter of they're supposed to do this or that. It's a matter of working together to see that the person is receiving services, they're satisfied, you know, as we just discussed, that they're being trained on that PCP, right? If the person is receiving something within their PCP, their staff should be aware of it, right? So you're working together with that provider to discuss those things.
Thank you, Nicolette. Another question I'll answer. So supportive employment staff have to have ACRE training and the CESP exam. So you'll note on those employment trainings on the matrix that we have created a runway. They are required, but we've created a runway to give providers time to get things in place to be able to meet that requirement. So this is not something you have to move on this second, and we'll be, putting out more information in the near future as to what that will look like. But you'll note in italics in those training boxes that that's noted for you. Okay. I think this time we actually did get them all. I don't think I'm lying this time. So as we've mentioned, we've got links to the both training matrices on the last slide of the presentation. Also mine and Nicolette's contact information. If you have questions, please do not hesitate to reach out to either of us. We're happy to help in any way we can. We really appreciate everyone's time today.
Thank you, everyone. Appreciate you coming.